Welcome to The Explainer. Today, we are tackling one of the most, and I mean most, misunderstood hormones out there, especially when it comes to women's health, testosterone. We're going to clear away the confusion and get right to the facts. So, let's jump in.
Okay, let's be honest. When I say the word testosterone, what's the first thing that pops into your head? Probably men, right? Big muscles, deep voices, the whole deal. It's basically been branded as the male hormone. But what if I told you that's one of the biggest myths in medicine?
Get ready for this. A woman before menopause has 4 to 5 times more testosterone in her body than she has estrogen. No, that's not a typo. 4 to 5 times more. Just let that sink in for a second. It's not just a little bit present in women. It is a major, major hormone. This one fact completely changes the conversation.
So today, that's exactly what we're going to do. We are busting the myths and getting to the truth. We're going to look at what testosterone really is, what it does for women, why it's so critical, and what the real story is on things like safety and dosing.
Okay, so first things first. Before we get into the weeds, we have to understand what we're even talking about. What is this hormone, and why does it matter so much in a woman's body?
So here it is, plain and simple. Testosterone is an essential hormone for all human bodies, full stop. The only reason we think of it as male is because it was first discovered in rooster testicles. Seriously. But that's just a historical fluke. In reality, it is absolutely vital for your mood, your muscle, your brain, and yes, your sexual health, whether you're a man or a woman.
And check this out. This is how it works inside your body. It's a simple pathway. Everything starts with cholesterol. Your body turns that into testosterone. And only then do your ovaries take that testosterone and convert it into estrogen. So you see, testosterone isn't just some separate hormone floating around. It's literally the parent hormone of estrogen. You can't get to estrogen without it. Now, this is super important. Estrogen, as we know, kind of falls off a cliff during menopause. But testosterone is different. It's a slow, steady, linear decline. It peaks when you're in your 20s, and by the time you hit your 40s, you've got about half of what you started with. This isn't a sudden menopausal event. It's a decades-long process that starts way earlier than most of us think. All right, let's get into the stuff that probably worries people the most. This is where all the fear and bad information lives. We're going to tackle the big questions head-on: safety, dosing, and the legality of it all. Let's just say it out loud, right? The two giant fears that loom over this whole topic are, is this stuff dangerous? And am I going to grow a beard and start sounding like a different person? And you know what? Those are totally fair questions, especially given how little good information is out there. Now, listen to this quote from urologist Dr. Kelly Casperson, because it completely reframes the safety discussion. We have decades of safety data from the transgender community, where trans men take doses that are 10 times or more higher than what's used for female hormone therapy. And they do great. The health outcomes are excellent. So if that dose is safe, it tells you a whole lot about the safety of the tiny physiologic doses we're talking about for women.
And that's the key right there, dosing. The goal here is not to make a woman more like a man. The goal is to restore a woman's hormone levels back to what they were when she was younger and healthier. We are talking about a microdose. It's 10 to 20 times lower than a male dose. It's not about masculinization. It's about restoration. It's about feeling like you again.
So the big question: is it legal? Yes, 100%. It is not illegal for a doctor to prescribe testosterone to a woman. The catch is, there's no FDA-approved product on the market that's specifically made and dosed for women yet. So it's considered an off-label use. But that sounds way scarier than it is. Doctors prescribe things off-label all the time, and in this case, they've been doing it safely for over 50 years. Okay, now that we've handled the safety concerns, let's talk about the good stuff, the benefits. And I'll give you a hint. It is about so much more than just sex drive. This is about your brain, your body, and honestly, your entire sense of self. Dr. Casperson calls testosterone a brain hormone, and I think that is the absolute perfect description. We always connect it to libido, right? But what is libido? It's a mood, it's a thought, it's motivation. And where does all that come from? Your brain.
Its impact on our mental state is huge. And just look at this list. Women who restore their testosterone levels talk about better moods, less anxiety, and feeling sharper. They talk about having more energy and motivation to go to the gym, and actually seeing results. They feel more confident, more assertive, but the one I hear over and over, the one that's maybe the most powerful, is that simple phrase, I feel like myself again.
And yet there's this massive disconnect. A huge study back in 1999 found that 43% of postmenopausal women report sexual dysfunction. 43%. Now, think about the ads you see on TV. It's all about men's low T. The entire market is geared towards them, even though women are clearly suffering just as much, if not more.
Now this is a bombshell. 2 different studies have suggested that women using testosterone might have up to a 50% lower risk of getting breast cancer. Okay, let's be clear, this is still early days, it needs a lot more research, but it is a stunning finding that flies directly in the face of all the old fears we used to have. Okay, so if you're listening to this and thinking, wow, this is interesting, you're probably wondering what the options actually are. So in this last section, let's quickly run through how this works in the real world. So there are a few main ways to do this. Creams and gels are the most common because you can apply them daily and get a very customized, tiny dose. There are also weekly injections, pellets that go under your skin for a longer-lasting effect, and something called troches, which are like little mints that dissolve in your mouth. I love this analogy from Dr. Casperson about pellets. She says using high-dose pellets is like flying from sea level straight to Everest Base Camp. It's just too much, too high, too fast. It can be a real jolt to your system.
And that really sums up the 2 main approaches. The expert consensus is leaning heavily towards start low, go slow. Using things like creams or gels allows for a really gentle, gradual process of restoring your levels. It's the opposite of that sudden shock you can get from some of the higher dose methods.
And of course, lifestyle is a piece of the puzzle. Getting good sleep, eating clean food, lifting heavy weights, all that stuff helps. And definitely stop smoking. It's just terrible for your ovaries. But, and this is a big but, as we get older and our ovarian function declines, there's only so much that kale and kettlebells can do.
So let's recap the big stuff. 1. Testosterone is a human hormone and it's absolutely crucial for women. 2. The decline starts way earlier than you think, in your 20s and 30s. 3. The benefits go way beyond the bedroom. It's a brain and body hormone. 4. Safe dosing is tiny. It's about restoration. And finally, number 5, you have to be your own health advocate because the system is still playing catch-up.
And I want to leave you with this one final thought to chew on. Why? Why do women have to fight so hard and do so much of their own research just to get help with a hormone that has been a fundamental part of their biology since day one? It's a big question. Thanks for joining us for The Explainer.